for having me. I'm a medical doctorate degree candidate, and today I'm going to talk about the Papa and Papa-like syndromes. Our article was a systematic review of literature, and our co-authors were Dr. Mahmoud, Dr. Newta, Dr. Sharana, Dr. Sohail, Dr. Yasin Afsan, and Dr. Ali Reza Mahdaviani, and as last but not least, Dr. Ali Akbar Belay. Okay, but what is Papa syndrome? Papa syndrome is an abbreviation for pyoderma gangrenous pyogenic arthritis and acne. It is an auto-inflammatory disease that caused by a mutation in a protein in chromosome 15. Papa syndrome first described by Linder in 1997, and in other articles show that in the first 2 decades of life, it's manifest more. In this study, we systematically reviewed the laboratory, genetic, and clinical features of Papa and Papa-like syndromes. Our method was searching in 3 main databases, PubMed, Scopus, and Web of Science. And after the searching by following keywords, overall 93 patients from 45 articles were enrolled in our article. Okay, about the results and demographic findings, most of the patients were from United States, and after that from Italy, Germany, and China. And sex ratio was 65%, and the age of onset median was 10.5, as I mentioned before. About our clinical findings, Papa syndrome has a classical triad, acne and pyoderma gangrenous and arthritis, but many of the patients do not manifest this triad classically, and we have lots of other symptoms and clinical manifestations, as you can see in this table. About presentation, many of the patients present in the hospital with arthropathy, and after that, escalations. And about the diagnosis, the septic arthritis is the first common diagnosis between the physicians for the patient. And about the laboratory and genetic findings, the elevation of CRP and ESR is the most common finding, and about 90% of the patients we have this elevation, and this is an important findings to diagnose the Papa syndrome. And about the genetics, many of the patients had mutation in PIP1 gene, and about just one found that they found that in the article was in NEFB gene. And many of them, about 20 patients had a mutation in C.68GA gene, and it was important too. And about the treatment, because it is an auto-inflammatory, we use anti-inflammation drugs, for example, corticosteroids, and or we can also use some monoclonal antibodies like anakinra. And these are some controversies between the physician to use these drugs. And in summary, Papa and Papa-like syndrome is an auto-inflammatory disease that less than 1/3 of the patients show the classical manifestation and classical period of the patient this disease. And currently, we don't have any standard approach for this syndrome. But many of the physicians use corticosteroids for the patients. And if you have any question, you can email me for my questions. Thank you so much.